Hey everyone, so we're going to move into the panel discussion portion of the town hall. My name is Sage. I will be your moderator for this session. And I am a youth expert board member. And something that inspires my advocacy is the need to do better and be better. And my favorite way to relax is Mad Libs. Fun fact for everybody. So I would like to introduce our panelists. We have Darielle Crawford, a clinical social worker from My Friend's Place. We have Jeffrey Richardson from Covenant House. And then we have Sung Jae Lee from UCLA, as well as Hunter Pixel, who is also another youth expert board member. Thank you all for being here today.
And Sage, Meli is also going to be a part of the panel today as well.
Okay, come on in, the more the merrier. And now we also have Meli coming in to join in on the panel discussion as well. Meli is also another youth expert board member. Thank you. So everyone, when you come in and I introduce you, please come in, say what your pronouns are, and also actually I did that for you. So I just want to dive deep into the questions now. Okay, to start for the first question, what are you hearing so far and what are the challenges? The what is being surrounded by COVID and the lockdown and also vaccinations. So I would like to start with Dr. Jae Lee, please.
So good afternoon, everyone. My name is Jae Lee, he, him, and his. And first off, I feel really lucky to be spending the afternoon with all of you. And it's been such an inspiring session so far. So I appreciate all of you and I feel really lucky. And as a full disclosure, I am an epidemiologist at UCLA, but I think I get inspired by interacting with community-based agencies and, youth with lived experiences. And I think in terms of the question about what I'm hearing right now, I think a lot of it has been covered already. And I think there's an important necessity to link the information that we have in the scientific community, but how do we bridge the information that we have to the communities that are impacted by COVID-19 pandemic? And for homeless youth and agencies that serve homeless youth, I think the very important thing is, I think messaging is important, how to dispel misinformation, but also how to prepare the right information to the messenger that are appropriate. So I would say I myself as an academic researcher is not going to be an appropriate person to convince a young person to get vaccinated. What is important is for me to engage with peer leaders like yourself and others that youth trust to provide the relevant information so that that information can be digested and processed by young people. So I can get started with that.
Thank you, Doctor. I would like to follow up the question with Darielle. What are some of the things that you are hearing, or what are some of the challenges that you have been?
Yeah, thank you so much, Sage. I think for me as a case manager, I have a caseload, of course, but I interact with youth on a day-to-day, and there has been conversations since the start of the pandemic about COVID and a lot of distrust around what's been happening, how it started, a lot of distrust around the government, and I think the challenges has been, really trying to figure out how could we create a system that support people who have been traumatized by systems, who have been underrepresented, like in our medical system, who are not seen and heard often, right? And I think that what has come out of that so far is really trying to roll with that resistance and roll with youth who don't feel comfortable, which is completely fine. And I think another thing too, like now that the vaccinations are starting to roll out, I would be curious to see how those conversations will shift or change now that people have access to it, especially our unhoused community, and what that will look like. So those are the things that really have been happening or coming up for me in my work.
Thank you. And I'd like to follow that up with, how do you have a productive conversation with the young people who are hesitant?
Is that,
Sage, I'm sorry, is that for me?
is that for?
Yes, that's for Darielle.
Yeah. I think really just engage in the active listening and acknowledging and validating those feelings. I mean, especially with our youth, our Black youth, there's just a lot of trauma, a lot of historical trauma associated with vaccinations and medical care. And I think as a person who identifies as Black, you know, I kind of know what that feels like. And so being able to resonate in that way and connect with them in that way is really important. And I think rolling with the resistance is part of that work, or working with someone who's hesitant, and just really, really wholeheartedly understanding that and creating space for them to express that, because that often doesn't happen.
Sage, I don't know. I don't know what the format is, but I just wanted to echo what Darielle was saying. I couldn't agree more. And I think we really need to understand and appreciate, you know, the world in which homeless young people live. And, you know, I think in terms of vaccine hesitancy, Dr. Rice, you know, mentioned that it is real, and vaccine hesitancy is not only for homeless youth, but also for healthcare workers. So I think, you know, Robin's point about having an opportunity like today's forum to have an honest conversation about, you know, dispelling some of these misinformation, I think is critical. And I think the challenge is, you know, how do we work with homeless youth to kind of think about what really motivates them, and come up with a better narrative instead of, you know, a scientific narrative about what, you know, how the vaccine actually works. But, you know, if we provide information about some context, for example, all the vaccine trials that we've done so far, we know for a fact that participants died from the trial. So that might be much more important and relevant than, you know, thinking about how to explain what mRNA vaccine works and how adenovirus vaccine works. So I think it is important to respect and understand the lived experiences around healthcare access of, you know, marginalized communities and, you know, BIPOC communities. And I think we need to respect that and understand, you know, how they're viewing the world in terms of care access and the level of, you know, trauma that they faced.
Thank you, Dr. J. Lee. Jeffrey, would you like to add to the conversation of how do you have a productive conversation with people that are hesitant?
Yeah, this is a timely question for me. We just had Walgreens out yesterday, who's local here in Hollywood, and they brought 100 vials of the new Johnson & Johnson vaccine. And it was our job to educate the youth and inform them about the benefits of getting the vaccine. And of course, as a steward of the agency and wanting our small community here at the Covenant House to protect, you know, their own health and the health of our agency and staff, of course, I was promoting it, right? But we had a little coffee and donut session yesterday morning, and it was very fun, informative, and interesting just to hear the differing opinions, you know. We had people who were concerned about being injected with microchips that would follow them. We had some that were concerned, you know, had generational concerns like, I need to call my mom, or let me talk to my uncle about this. I don't know about this. And I think sometimes, you know, just exercising their choice, sometimes it's just no, right? It's kind of like right now it's a no. And I, you know, I have to be okay with that, right? Because it doesn't mean that no is a total no. It's just like right now, I'm gonna watch some of my peers that took it and see how they respond. watched some of the staff who took it. I was really impressed. Initially, when we started to pass out flyers and let the youth know that Walgreens would be here, I was very pessimistic that, you know, we wouldn't get many youth to get the vaccine. And we were able to get 28 vaccinated yesterday. So to me, that was a phenomenal number. We had several that made the last minute decision to do it. And I'm super optimistic that after they're able to share those experiences or their experience with taking the vaccine, and then over some time, they will be able to, give information to their peers. I think that's our most valuable tool is that peer-to-peer interaction and conversation that's going to help us, maybe get more people vaccinated.
Thank you, Jeffrey. And if I didn't introduce you before, this is Jeffrey Richardson from Covenant House in Hollywood. To the next question, how do we build supportive networks for youth? Hunter, I'm going to pass this to you.
Hey, building supportive networks for youth. First, I think importantly is just getting a contact person. I feel like not necessarily a case manager, but just to have a point person when it comes to setting up the youth for their appointment and their follow-up appointment. Because as someone who has gotten the vaccine, just the first dose, it was really hard to navigate. It was hard to make the appointment. And when I got there, I didn't know that I had to wait an additional 2 hours past my appointment. And so just like being upfront with that in the future overall, I think would be a great start.
Thank you. Meli, I'm going to ask you the same question. How do we build supportive networks for youth?
Yeah, give me a second because I did write all my answers down so I can concentrate better.
Take your time.
I guess like for me personally, I stay in like close contact with a lot of like people who work in the industry. So that's how I do it. But for other youth, I would say through social media and through like people that they trust, like at different like youth centers and things of that sort.
Thank you. Good job.
I also think that like making chats is also a really great way to like reach out to a lot of different groups and a lot of different variety of people all in one place.
Thank you, Meli. I appreciate that. And Meli, I want to ask, what have you been hearing so far? And what are some of the challenges that youth may have came to you and expressed?
I've heard a lot. I've heard like definitely a lot of negative. A lot of youth have said a lot of negative things about what's been going on. People are scared of getting the vaccines because they don't want to have like allergic reactions, or they don't. A lot of people have like conspiracy theories that they don't want anything to happen to them. They said they're like, I've definitely heard the microchip thing about like the government using the vaccine to track people down. So I've heard a lot of negative, but I've also heard a lot of positive because like I said, I keep in communication with a lot of people who work in the industry. So I have friends who work in Project Room Key right now, and they're getting the vaccine. So I've heard like on a personal level, like a lot of positives, you know, them saying that like, you know, yeah, my arm was sore at first, but overall it was just like a regular vaccine. I didn't have any negative effects. Everything went pretty well, and they suggest that, you know, a lot more people get the vaccine. So but it's mostly people who are in the industry that I've been hearing a lot of positives from. And the negatives I hear from people who are not really involved in the industry, because they're not getting enough information. So, you know, they kind of like make they have their own opinions based on, you know, their frame of reference. But as far as actually getting the vaccine, I have heard that it's a little tedious. You know, the lines are really long. And you don't really know what to expect. I had a friend who was waiting in line for 4 hours. And so it definitely is like a very like exhausting experience from what I've heard. But that's it's pretty much what I've heard so far, other than people being, you know, a little scared because so many people are getting it. So many people are getting COVID.
Thank you, Meli, for your input. I appreciate it. I want to ask this of Darielle. How can we create more resources for young people?
That's such a good question. And Sage, I just want to make sure I'm following along as it relates to access to the vaccine, or
Access to the vaccine, and if needed, unnecessary aftercare.
unnecessary aftercare. Yeah. Such a good question. I really think it's just all about collaboration with providers. And I think it's so important. And I think in my work that I do now, it's so important not to work in silos. And I feel like sharing those resources with other providers is so important. Voicing what we heard about what's coming down the pipeline or what's upcoming is so important too as well. And you know, one of the things that we've done at my friend's place is we now have on Tuesdays, people can come and get vaccinated. You can come and get vaccinated. I mean, not vaccinated, I'm sorry, COVID tested. And that has been huge. That has been so helpful, because as part of the housing process, we've seen that a lot of the providers were requiring people to get tested. And so now that we have that resource on site, it creates access. And I don't know if that's something that can be possible for vaccinations, but I think that for other providers, but I think that is so huge and really important to be able to provide that resource in order to increase that accessibility to vaccines. So collaboration and you know, just really having that conversation with other providers is huge and huge for me, I think.
Thank you, Darielle. I'm going to ask the same question to Jeffrey. How can we create more resources for young people?
I would say networking with the local community. As I stated earlier, it was the local Walgreens manager that coordinated coming over here. So it was that relationship that we had with the local, you know, store, pharmacy down the way. So I think getting out there, letting people know who you are, and that we do have, you know, vulnerable youth out here that could use not just vaccines, but information about COVID-19, and inviting people in over Zoom to talk about it. This conversation is very helpful for me, and I think it would be for a lot of our youth to get experts' opinions from Dr. J. Lee and from Darielle. You guys have been great, but I think the diverse diversity of information, right? So you can hear from multiple sources. When someone was talking about listening to the news, it was in the first video you showed. They said they don't watch one news channel, they watch 3 different news channels and kind of figure out and take what they want from each one to find their truth. So I think similarly, we got to have diverse people at the table to have that conversation so that we can, you know, collectively, you know, inform our youth.
Thank you, Jeffrey. Dr. J. Lee, same question for you. In what ways can we create more resources for young people?
Yeah, so thanks again, Sage. And again, I really appreciate this conversation we're having. And I also appreciate Jeffrey and Darielle, your comments. I think what is important, so I totally agree this cross-agency collaboration is really key. But I also want to kind of challenge all of us and say that we really need more funding for, agencies like Covenant House, Safe Place for Youth, and LA LGBT Center to really support our youth. And, I think, COVID-19 vaccination, we can also use it as an opportunity to frame this as, working with youth to promote overall wellness. And, Jeffrey, your comment about, relying on folks that went through the vaccination and then have them share their real experiences about, what it is like to get vaccinated, I think that's key, because I think they trust their peers. And also at the same time, if the vaccination is multiple doses like Pfizer and Moderna, I think it's important for us to really understand how difficult it is to make sure that youth come back for the second dose and have enough funding to provide transportation, for example, appointment reminders to make it as easy as possible for young people to get fully vaccinated. And, I think in terms of potential side effects, it is also important to really intentionally think about maybe providing a temporary housing when they have severe side effects, because that might be a motivation not to get vaccinated because they're afraid of having severe side effects. And then the other thing is, when we get vaccinated, from as far as I know, we have that 15 minutes after vaccination that people have to wait to make sure that they're okay. I think those 15 minutes are really valuable in terms of, working with youth to provide like needs assessment, provide any kind of referral services for example, mental health. So I think we can kind of see it as opportunities, but to make that happen, we really have to push our government and funding agencies to really advocate for more funding for all this wonderful work that you all are doing.
Thank you, Dr. J. Lee. I'm so glad that you mentioned the temporary housing aspect, because that was one of the things that I was thinking of in terms of, okay, there's a process of getting the vaccinations, but also what about necessary aftercare if someone does seem to show side effects that are very unwarranted or unwanted and they can't really recuperate immediately from within that 15-minute window. So thank you for highlighting that. Thank you for highlighting that. Okay. And my last question, Hunter, I'm going to start with you. What can help guide discussion? Hunter, you are a peer support specialist, so you are a direct face-to-face resource for the young people that you see at your job, the LA LGBT Center. What are some of the ways that you think can help guide discussion? And then what are some more innovative ways that we can guide discussion further along the COVID-19 livelihood that we're in now?
Definitely have more resources like this where we speak to an actual professional to answer any questions or concerns we may have would be great, because a lot of our people that we serve don't have access to healthcare at all, and a lot of them are don't want to be misinformed. And so I think that would be something that we should do.
Thank you, Hunter. Meli, I'm going to ask you the same question. What can help guide discussion?
I definitely think that the best way to guide a discussion about things like this, and honestly, like any topic that becomes like political or controversial, is to like reassure people that you respect where they're coming from and that you respect their opinions. You don't ever want to make anybody feel like you're necessarily debunking how they feel, because like I said before, everybody comes from different point of views. Everybody comes from like different experiences, and those experiences like develop your opinion and it develop how you feel about things. So I think the easiest way to like, you know, guiding the discussion and keeping somebody's attention during the discussion is to like just make them feel like they're comfortable and they're, you know, they're able to like speak and they're able to say, you know, how they feel, and they're able to like, you know, state like where they're coming from.
Thank you, Meli. And Darielle, I am going to end on you with the same question. What can help guide further and future discussions?
Yeah, I just want to thank you, Hunter and Meli, for sharing that. And I share very similar sentiments. And I think that just going back to being able to sit with the hesitancy is super important. And I think just really acknowledging how this is a difficult time for all of us, and we're making these really hard decisions. And there's so much that goes into that it's influenced, and how we decide something very similar to what Meli said. And I think that's part of that discussion. That's part of sitting with that and acknowledging that all of that. So that's kind of how I feel about it.
Thank you, Darielle. Panelists, is there anything, we have 2 minutes left on our clock. Is there anything that I may not have brought up that you feel the need to get out right now? Please say it now, forever hold your peace.
I do. I just want to share something that I just thought about right now. So I have 28 youth out here that just got vaccinated with the Johnson & Johnson vaccine, and they're having some side effects. You know, there's some sniffles, body aches. And I was thinking, who's giving them the soup, right? You know how when we're sick, we have a family member that's making chicken soup. So I'm gonna go make some soup right now and make sure they get some.
Thank you, Jeffrey. I know they're gonna appreciate it, especially because
I know I need some too. I'm definitely doing that.
Thank you, because it's definitely overcast. I thought it said the rain was gonna clear. Clearly it hasn't. So thank you for that. That means the world to them.
Yeah, thank you guys. This was great.
Thank you.
Yes, Sage.
Yes, Tony?
If I could ask a question just in general for everyone. So to what Meli said, you know, we all have our own information. So as people who are relaying information to young people at our different organizations, how do we make sure our own personal bias isn't, you know, coercing anyone into taking it? But I also get that, you know, telling someone, hey, I'm okay and I got it, you know, might be a good example to, you know, tell someone, hey, you know, someone you know got it. But how do we also make sure that we're not using our own personal bias, you know, to coerce anyone into getting the vaccine?
Great question, Tony. We can take 2 panelists input on that.
I think that like at the end of the day that another important thing to like remember is that although everybody has their opinions and although everybody is experiencing a different like perspective, not everybody reacts the same. And so it's important to not like sort of force people and be like, well, it went well for me, so it's gonna go well for you, type of thing. So I think that as long as you're not like trying to like convince or kind of like trying to like sway or force anybody into doing anything, that it's, you know, it's still like, it's great. Because I have run into a lot of people, they've told me like, well, you know, I know these facts and so you should do this. And it's like, you know, at the end of the day, people are a lot more comfortable when you don't try to like force them to do things. You don't try to like overwhelm them with facts, because you know, it can be really exhausting when you like overwhelm someone with a lot of facts, you know, and you like try to tell them like, you know, this is what's the truth and what you feel is just an opinion. You know, that can, you know, discourage a lot of people, make them feel very uncomfortable. So I think it's important to like, you know, understand that even though there are things that are, you know, true, solid facts, it's still like important to give people the space to make their own decisions, because at the end of the day, you know, that's their body and that's their decision.
Thank you, Meli. And unfortunately, we don't have time to get to the last panelist because we want to move into our call to action. So I would like to thank all of our panelists we had today. Meli Flores and Hunter Pixel of the Youth Expert Board, Dr. Jay Lee from the Department of Psychiatry and Biobehavioral Sciences at UCLA, Jeffrey Richardson at Covenant House, and Darielle Crawford from My Friend's Place. Thank you very much. Now we'll